Hey guys, what's up? What's up, guys? Here from Colombia with love. We're gonna start this Endo Coffee. Just 20 minutes with some Endorantic topics. Thanks to EndoStar for the invitation. My name is Jorge Gaviria. Hi guys, what's up? So, we're gonna talk a little bit about Azure instruments, but I wanted to talk also about Polestar's best kept secret, the S files. So, we're gonna start this chat right now. Well, that's me. I'm Jorge Gaviria. I'm from Colombia. Right now, I'm here. I hope everyone is enjoying their quarantine, enjoying this time with your family. Keep it safe, staying at home, and be careful. You have to be careful right now at this moment. We have to enjoy our families right now. Okay, we're gonna talk about some clinical cases using Azure. I'm an endodontist. I studied dentistry in Brazil in the Estácio de Sá University and endodontics in the Santo Tomás University here in Colombia, okay? Well, this is my beautiful city, Bogota, the land of Shakira and the best coffee in the world. So I hope you can come someday here. This is at the north part of the city where we are near the mountains. We have very beautiful buildings and skyscrapers, and we have lovely people here also. Well, this is something I wanted to talk to you guys about. Um, these files are one of the most amazing files I've seen. These are manual files, but these are called the S manual files. What are they? They are there is a hybrid of two headstrong files. They have an amazing and great cutting ability. They have very high removal of dentin debris, a precisely cut shape made of stainless steel. The cross section is like an S. It's a non-cutting tip, obviously. An amazing flexibility. Remember, it's a stainless steel. They have the millimeter scale edge at the top, and they have the ISO symbols. I always use these files when I am going to start a case. Sometimes people like to start with the rotary files just at the beginning, but I'm a believer that you have to find your glide path first, okay, with manual files. This is the protocol that I use, or that I based my cases on. First, I start with a 10 file S file, then a 15 file and a 20 file till the apex. I'm going down till the apex so I can have predictable and reproducible glide path. Remember, you have to irrigate and disinfect however you want. You can use sodium hypochlorite or use a chlorhexidine, a 2% gel. Everyone uses what they want. I use sodium hypochlorite, okay? After I have my glide path, I start with this file. It's the 38% taper file with one blue stripe. You start opening and widening the entrance of the canal. Be careful with this file. You have to be careful with this. This one is the most important phase for me at the beginning because it can occur breakage. So you have to be careful. Don't just one stroke, maximum 3 strokes at a slight pressure, okay? Then you can continue with a 20 or 25 6% taper file at the entrance or till resistance at the middle part of the canal. What is amazing about this system is that you can exchange files, you can create your own protocol. You can use also as an orifice opener, You can use the 20 and 25 6%, but also you can use the 20, 25, or 34% files. You have to be very careful. Obviously, in narrow canals, you're going to use 4%, and in wide canals, you're going to use 6% taper. Okay, then after you reach the middle part of the canal, you start trying to get into the apex, going down to the apex to your working length. So you can go directly to a 20 or 25 4% till the apex or the working length, but also you can start creating a space with a 25, then going to a 20 with light pressure, and then you can repeat this sequence. Remember, you have to be careful. You can go, sometimes you can go with just one file, two files till the apex, but you have to be careful. Remember that there are hidden curvatures and there are narrow canals or maybe calcified canals. Another amazing thing about Azure is that you can use these files in rotational or reciprocating motion. I find better to use them with the adaptive motion, okay? Not using wave one motion or reciprocal motion, okay? But that's just me. It's what I have found. It's my personal opinion, okay? Try by yourself. Well, there are some cases, simple cases. This is a simple chat. This is a recently cemented horrible zirconium crown, and the patient developed irreversible pulpitis. Okay, it was a wide canal, so I opened it. I got an entrance through the crown with a bar. It was just one canal. I'm talking about the second premolar. Okay, I starting preparing with a 25 6% at the entrance, widening the canal as an orifice opener, until resistance at the middle part of the canal. Remember, first of all, you have to use your manual files, the S files in this case, okay? I think in this case I use it till a 20 or 25 S file, okay? There are 2% files. Well, then I reach the apex with a 25 6% on reciprocation motion. And that's it. I then use my disinfection protocols. You can use your laser, your PUI, or whatever you want, agitation, whatever you want, okay? And this is the finished tooth. The X-ray is not the best, but you can see a little sealer puff and just single cone with bioceramic sealer and condensation technique, okay? The continuous wave obturation technique, okay? Well, these are the cases that we like, but we love to hate, okay? This is a lower upper molar with a very decayed crown and wide distal canal, narrow mesials, and a distal lateral exit on the distal canal. So I started this one with a 25 6% at the distals, at the entrance, the mid resistance in the canal, and I finished with a 25 on reciprocating motion. Okay. Then with the mesials, it was a different thing. I started my entrance with a 26% file on rotational motion. Then I use a 25 4% till the mid part till resistance. Be careful in this part, slight pressure, just one, maximum 3 strokes. And then at the end, I finished with a 24% file, okay? Here goes again, these slides go, they have life of their own. Here, and you can see the obturation, you can see the lateral canal and the distal, and both mesial canals filled. One thing, these mesial canals were filled with a gutta percha 34% point. They not always they match your master file. So you have to be careful with that. You can finish with a small apical preparation, but your sometimes, depending on the brand, your feeding cone is gonna be another one, bigger one. Continue here. Okay, let's go here. This is a second upper molar, a second upper premolar, sorry, and there's a slight curvature. You have to be careful with these cases. I thought this was gonna be very narrow or with a deep split or something, but it just was just one canal. Okay. I started with a 25-6% on rotational motion at the entrance till the mid part of the canal. I continued till the apex with a 25-4% till resistance on rotational motion. Also, you can also use reciprocating motion. Then I continued with a 34% because the file wasn't engaging, so I knew that I have more space and so I can go with a bigger file. Then I continue with a 35 file and I finish here, but I fill that canal with a 44% gutta percha bioceramic cone, okay, with biosealer, and there's the space post to the curve, okay. Let's continue with this other case. It's a young patient. You can see there's a slightly root reabsorption on the distal root and two radiolucid lesions on the distal and the mesial. The distal is wide, it's a big canal. There are two canals, and in the mesials they are a little bit narrow, not that narrow, but they are the big canal that would wait for this kind of cases. So I started, this is a big canal on the distal, so I started with a 25-6% and the entrance, the resistance at the middle, at rotational motion. Then I continued till the apex with a 25-6% on reciprocating motion. Sometimes with reciprocating, you have more feeling or what you're doing. You have more control of your file. It's just a personal opinion. So you can see that the file cuts more and you have control of the file. And I finished both distals with a 34% file. That was it for me. The apex was narrow. That was my working length. So I decided to stop there. Okay? Then with the mesials, I started with a 25-6%, the same thing. Remember, there are narrow canals, not that narrow, but they are narrow. I continued till the apex with a 24% file. And I finished this canal with both canals with a 25-4% file. You can see the finished result. We have a small preparations, narrow canals, but sometimes I like to over prepare a little bit with over instrument 1 millimeter over the apex just to clean a little bit and to widen my apex size. So sometimes that you can have variations with your master cone. That's why you have to fit the cone and take x-rays for that. You can see the preparation. This is an MTA sealer, the Avalon sealer, with the gutta percha point and a lateral canal on the distal. You can see it over there. Okay. Well, forget about the first molar. Okay. The patient is not having anything on that molar. She's okay, believe it or not. Miracles happened, but she's having pain in the second lower molar. Okay, there were only two canals, two big white canals, and radiolucency at the apex. So I started working this with a 38% as my orifice opener in both canals. They were really wide. Then I continued with a 25-6% on rotational motion till the apex, okay? And then I continued with the 34% and 35-4% till the apex. I prepared both canals the same way, and they joined at the apex. You can see the final result here. Okay. These are simple cases, but what is important about this is that not all the cases are the same thing. You have to think about it. Sometimes you think seeing the x-ray while seeing your CBT, or while during the treatment you take decisions. You have to think what is better for you and for the patient and for the tooth. The less preparation and the less stress you give your file and your tooth, it's gonna be the best for the for it's gonna be a better result in the future. You have to think in the future. Okay. In this case, I decided to do things a little bit slightly different. I started with a 34% at the entrance, at the mid part of the canal, and I finished at reciprocating motion till the apex with a 25-4%. That's it. For me, the file was engaging. I was happy with the apex size, so I decided to finish there. And the cone fitting was done with a 34% bioceramic gutta percha point. This case, it might seem like a simple case, but it wasn't. It was a really narrow canals at the apex on the mesial and the distal roots, and a wide open root space. The root palatal, the palatal root was really wide. So I started with a 38% in all three canals. The same thing, opening the entrance, widening the entrance, one, two, or three packings with a light force. Then at the mesial, I used a 26% on reciprocating motion till the apex, and I decided to finish there. Also, yeah, so 24% till the apex on the mesial canal. That's it for me. That was working. I decided to end there. Then, with the palatal root, I jumped from the 38% file through a 44% file. Why? Because I got a big space. I was able to do it. You have to be careful, but I was able to do it. And in the distal root, I used the 38%, then the 26% reciprocating motion, and I finished with a 25-4% file. Remember, we're always irrigating all the time with sodium hypochlorite, 6%, whatever you want, chlorhexidine and gel, 2%, not mixed together, obviously. Let's continue with these cases. This is a second upper premolar, and you can see they are very narrow canals, very narrow. So I decided to start here with a 25-4% file at the entrance to the middle part, and I finished with a 24% file and a 25-4% file till the apex, till the working length. It looks easy, but it isn't. You have to be careful with these cases. You have to believe your gut and be careful, because in these narrow cases, it's better to use reciprocating motion. That's my opinion, okay? In this upper molar, we are using narrow preparations also. I started with a 26% in all three canals. There wasn't an MB2 in the entrance to the mid part till resistance. then a 25.4% till the apex in both three canals, and that's it. That's it. Well, this is a different case. I think we have a little bit of time to do it. Boom. Okay. There was this case. I don't have the initial X-ray, unfortunately, but there was an over-extruded good aperture point with this case. So I decided to get that good aperture point from the apex and from the bone using a 45.4% file in reciprocated motion. It works really, really, really well. Sometimes it's a file that we don't use that often, but it's amazing. It works. So, and the obturation was made with a 30, no, 60 or 32% good aperture point. Okay, and the root space, there's an opal dam there, don't worry, guys. Okay, and this upper molar, there were just two canals, narrow canals, and curved apex at the apex. I started with a 26% file at the entrance to the middle part. Then I finished with a 25 a rotational motion, 25.4% in both canals, the buccal and palatal. And then I decided that I needed more space for the post. It was very narrow, so I just used a little bit of a 25.6% rotational reciprocated motion to widen the space. They both joined at the apex, and there's the post is already has a the post space post preparation. Okay, well, this is a narrow canal, lower molar, lower first molar. Well, I started with a 26% file in the mesials, light pressure, just one pecking, maximum three peckings, brushing the canal, brushing the walls, then till the apex at 24% final rotational motion, and that's it on the mesials. For me, that was enough, okay? Then I continue on these toast with a 4% 25 file till the apex, but I started obviously before that with a 26% or rotational reciprocated, whatever you want. This upper central incisor, you see that is maybe a simple case, but it was a wide canal. So I started with a 25 on rotational motion. I went through the apex, till the apex easily on rotational motion. Then I decided to clean the apex with a 25.4%, but in this case I could have jumped to a 35 or maybe 40 directly instead of going using all the sequence. But if you're not used with the system, you can follow the protocols, okay? Finish with a 35 and a 40. Okay. Well, guys, that was it. I think I hope you enjoyed this talk. A little bit of everything. It's only for you to know these Azure files. They're amazing. Believe me, they don't break. So they are very inexpensive files. They are Poland's best kept secret as like S files. So I'm gonna invite you to the next Endo Coffee, April 23rd, with Dr. Mohamed Kataya. 3 p.m. Polish and local time, and Egyptian time is the same thing. Thanks, Endostar, and I'm ready for your question. Okay, we have some questions here. Let me do this. Moment, guys. I'm here. Guys. Okay, we have our questions here. First questions. Paradent, in which cases do you use the needed two files from Endostar? And in which step of RCT? Needed two files. I don't use them that much. I don't like using the needy manual files, but the Endostar has needy engine files. They're really good. You can use it at every moment. There's no need. There's You can use it at the beginning, replacing the manual preparation with S files. That's a possibility. I like those files. I like them for agitating or doing the agitation of the sodium hypochlorite with a 32% engine file from Endostar. Okay. What is your cleaning protocol with flushing agents you like to use the most? Okay, I'm gonna talk this. This is very. I love sodium hypochlorite. That's for me the way to go from the beginning. I use sometimes EDTA while preparing narrow canals, but I'm going all the way, flushing, irrigating, flushing, cleaning, all the time with sodium hypochlorite. And at the end, I use PUI and I agitate the cone. Or sometimes I use laser, but not every time.